Good afternoon and welcome virtually to Old Dominion University and its Remote Experience for Young Engineers and Scientists program known as REYES. My name is Giovanna Gennard, Assistant Vice President for Strategic Communication and Co-Chair of REYES, and I will serve as your host for today's event featuring Dr. Carolyn Rutledge and Dr. Tina Gustin from ODU's College of Health Science. At this webinar, we have many guests from around the globe, including the Honorable Fernando Jorga Castro, Costa Rica's ambassador to the United States. We are honored he's joining us again today. Throughout the webinar, you may submit questions through the Q&A box on your Zoom screen. Following Drs. Rutledge and Gustin's lecture, we will answer as many of your questions as time allows. The purpose of the Global REYES program is to provide an engaging virtual learning experience to inspire future scientists, engineers, and high-tech entrepreneurs. And today, we have the honor to hear from two internationally renowned experts who are sharing their expertise in telehealth innovation with future generations of STEM age-minded students. Old Dominion University produces the second largest percentage of STEM age graduates in Virginia, and we have a long history in health sciences. We also produce more health sciences graduates in Hampton Roads than any other university, about 1,000 graduates per year who stay and work in our region. In addition, ODU has made more than $225 million in STEM age investments, including a new chemistry building, which is going to be opening in the spring, a new health sciences building, which is opening in 2022, and a new biology building that's currently in planning stage. In 2018, we expanded our School of Nursing, which was established in 1967, and launched the Center for Telehealth Innovation, Education, and Research in Virginia Beach. We also are home to the Center for Global Health. Most recently, Centera Healthcare awarded a $4 million grant to ODU and Norfolk State to help develop a regional school of public health. The new school will work to reduce health disparities and bolster health sciences programs in Hampton Roads. Today's virtual visit with Dr. Carolyn Rutledge and Tina Gustin is a tremendous opportunity to gain insights into telehealth, its impacts in health and healthcare, as well as the latest innovations with a focus on healthcare to rural and underserved populations. It is now my pleasure to introduce Dr. Carolyn Rutledge and Dr. Tina Gustin. Dr. Carolyn Rutledge is professor and associate chair of nursing at Old Dominion University, where she directs their Deep NP program. She has published more than 60 articles and served as an investigator on 28 grant applications totaling over $21 million, focusing on new models of care such as telehealth to provide care to rural and underserved populations. She is a sought-after national consultant in telehealth education and had a book, Telehealth Essentials for Advanced Practice Nursing, published in June of 2020. She is the academic director of the Center for Telehealth Innovation, Education, and Research, known as CTIR at ODU. In 2014, Dr. Rutledge received the Chev Outstanding Faculty Award, which is the highest honor provided to faculty in Virginia. And then Dr. Tina Gustin has more than 35 years of advanced practice nursing experience. She is currently associate professor at ODU, School of Nursing, where she teaches in the Doctor of Nursing Practice program. Her most recent appointment was as director of the school's Center for Telehealth Innovation, Education, and Research, again known as CTIR. The center serves as a telehealth learning hub and research center not only for the state, but also for the East Coast region of the United States. She is the clinical manager for the pediatric telehealth program at Children's Hospital of the King's Daughter in Norfolk, Virginia. And she has been responsible for the development of this new program and assuring the clinical competence of telehealth practitioners. She is also the PI and co-PI for several Health and Human Services Administration grants totaling more than $6 million. These grants are aimed at reaching the rural and underserved through telehealth and interprofessional collaboration. She also has extensively published and presented in interprofessional teams-based care and is preparing providers for telehealth both nationally and internationally. So please join me in welcoming our experts, Dr. Carolyn Rutledge and Dr. Tina Gustin, who will discuss telehealth innovation. Dr. Rutledge and Dr. Gustin, would you please turn on your microphone and video so we can see you?
Hello. Good afternoon. We're really happy to have you here with us, and I'm going to pull up our slides to share with you. Okay, hope you can see these. I am Carolyn Rutledge. I'm a family nurse practitioner and have practiced as a clinician for over 32 years. And thank you for the very nice introduction. And like was mentioned, we're the co-directors of the Center for Telehealth Innovation and Education. So when you look at the word C-tier, we look at it as an area where we have three pillars that we look at. The first, the I stands for innovation. We've been very, very involved in innovation as part of our center. And Dr. Gustin, during the second half of their presentation, will be sharing some of the experiences there. The E stands for education, and we have become quite nationally prominent in the area of education. We're one of the maybe two schools in the nation that focus telehealth education out of nursing and are working on developing competencies nationwide. I will be educating you a little bit about telehealth in the first portion of it. Our third tier is research. The R stands for research. And we focus on research when it comes to patient education around telehealth. And we also encourage our doctoral students to do their research in areas of telehealth. And we've had probably about 40% of our students integrate a component of telehealth into their research studies. So there's several things we would like for you to accomplish as a result of our talk today. One is we want you to understand a little bit more about telehealth and telemedicine. What is the difference? What does it really mean? We want to share some of the models of care that are available. We want to discuss some of the innovations, and we want to help you start thinking about ways telehealth might be of interest to you, ways it can fit into maybe some of your career choices. So who are our telehealth players? And I would think many of you that are on this webinar have thought about telehealth from the perspective of, okay, we have a physician or a nurse practitioner meeting with a patient. And so often when you think of telehealth, they're the only two people you consider. But really to run a telehealth program, you have to have quite a few people behind the scenes. You have to have staff support. And that can come from administrators. It can come from staff members that are coordinating schedules with patients. It can come from IT that is helping to run the technology allowed forward. Engineers, they are very important because they're the ones that are developing the equipment that allows us to deliver telehealth. Computer scientists, many of our programs and apps are run through apps on our computer. So there are lots and lots of roles along there. The researcher, you know, we focus on research looking at, is it financially feasible? Are our patients and providers satisfied? What kind of outcomes? But research needs to even go deeper. What makes for the type technology that patients can use most easily? Does the technology maintain the security we would hope? So there are a lot of issues to explore about the equipment just alone and how it's used to deliver telehealth. Entrepreneurs, I mean, that is huge. Since March, the number of entrepreneurs that have moved into the telehealth arena has escalated. It is seen as one of the new and upcoming markets. Then, of course, looking at it, your policymakers. If you're going to deliver telehealth, you're going to have to break down some of the barriers to healthcare. And policymakers are involved in things like broadband, figuring out where and supporting where they deliver new broadband services. Also, if you think about what happened with COVID-19, policymakers had to break down some of the barriers. They had waivers allowing people to practice from one state to another, which they had not been able to do before with telehealth. It allowed them to use things that were not, or devices that were not HIPAA secure, like FaceTime. So they had been very active in making many of the decisions and allowing telehealth to move forward. There will be changes coming up, but we need to stay involved with that as well. So what is telehealth? It's using technology to provide healthcare services at a distance. And it can be patient care, it can be mental health counseling, it can be consultation with experts or between one provider and another. And really another area that's huge is your disaster management or handling emergencies. And Dr. Gustin will cover some of that a little bit more as well. This is a model that I often use when I'm describing telehealth. You hear the term telehealth, you hear the term telemedicine. Telemedicine is where you're really actually getting involved in patient care, whereas telehealth can include patient education, it includes telemedicine, consultation. So telehealth is much broader. So when you look at what's happened as a result of COVID-19, it has changed how we provide healthcare. Consumers or our patients are now expecting it. Technology is improving. And you can see some of these charts where between April of 2019, it was here, and look at where it was 1 year later as a result of COVID-19. So it has escalated, and they're expecting it to stay at between 30 and 40% of the visits once our pandemic is behind us. So telehealth is used to connect your patients or your providers to patients for care, education, and counseling. It's used to connect clinicians to clinicians to allow people or your clinicians to find out information from experts. It allows patients to monitor their own health. And many of you may have smartwatches that you track some of your physical activities with. So that would be a type telehealth. If you're looking at heart rate, you're looking at changes in your diet that you monitor. There's so many different things that we use our smartphone and our smartwatches to monitor along the health area. And you may not have thought of that as telehealth, but it is. So the types of telehealth delivery, when we break it down, we think of it in two categories, synchronous and asynchronous. Synchronous is your live, it's video conferencing, it's what we're doing right now, where we're communicating with each other at the same time. Then with telehealth, there's asynchronous, where data is collected, but it might be stored or transmitted at a later point. So in breaking it down a little bit more, you think about your categories, your live interactive, which is what we're talking about. That can be a standalone service, or it can be incorporated with these others. These others can be standalone as well. You have your store and forward, which we'll be discussing, your remote patient monitoring, and the mobile health. So the live interactive, again, that's real time. And for those of you that are thinking about things like engineering, computer science, so forth, you'll be thinking about some of the devices that are used to deliver it. Like it might be tablets or smartphones or your computer. You might have a telehealth cart that is made just for telehealth delivery that has attachments to measure your heart rate, listen to your lungs, listen to your heart, look into your ears. they can be attached to the device so that we can see what's in someone's ear at a distance when the technology is used. There's smartphone adapters that Dr. Gustin will introduce you to. One of the areas that's kind of exciting are kiosks, where they actually have little boxes that you can go in and connect to providers. Many of these might be in some of your drugstores. And another exciting area that's really escalating is with drone delivery. I mean, even delivering things like the AED to handle heart attacks. So you look at the devices, then you look at the platforms that run them. Zoom, that we're very familiar with. So some of them are very expensive, some of them are secure, some are not. And what I mean by that, it protects the patient's information and some don't. So two very important areas, the equipment itself and then what is utilized to run it. So live interactive, we might use that for things like managing patients with chronic illness. Some areas that I think are pretty exciting is like mental health counseling. They're actually finding that some people are doing better with mental health counseling by having it delivered through telehealth. Part of that is the patients are more comfortable in their home. Another area where they've had some great results is dealing with patients with dementia and Alzheimer's. They feel like they're able to assess them better by coming into their home as opposed to having the caregiver get them dressed, put them in the car, transfer them to somewhere else, and they are disoriented by the time they come. So there's so many different areas that this live interactive can fit. And this is the area that has really escalated as a result of the pandemic. So an example might be a patient that comes into the primary care provider in rural areas with neurological concerns. The primary care provider might want them to see a neurologist, and there are no neurologists nearby. So they schedule a meeting with the neurologist, with some of the family members, with the provider and the patient, and all come together, and the neurologist can examine the patient at that time. So you're able to bring services from a far distance. And this is just strictly with the video conferencing. You add peripherals to the video conferencing, and you can do even more. Like, for instance, we work with the Health Wagon, which is in Southwest Virginia. It goes out into the rural areas. They have a big van that they take out. And they also have 2 standalone small clinics. Well, we helped them purchase a telehealth device that checks for bladder cancer. And so these 2 nurse practitioners there can bring a patient in that they think might have bladder cancer. They use this telehealth device to go into their bladder to observe it, but they have a specialist in urology 300 miles away looking at the very thing they're looking at. And so they're able to do biopsies and do this evaluation without having the specialists in these rural areas. Really being able to equalize the care across different geographic regions. Store and forward, another method. This is where you collect the data, store it, and transfer it to the provider. It can be cameras, it can be imaging equipment, it can be diagnostic testing like an EKG. My father has a pacemaker and a defibrillator. He has a monitor that's hooked into the phone system on the wall. And when he goes by it, it will run a rhythm and send it to the cardiologist. One of the things that you have to keep in mind, and an area for research and to be careful about, is making sure it works. So my father and all of the family thought it was working just fine because it was hooked up. Something had happened, there had been a power outage and it had not been reset. And it turned out that it wasn't alarming. And my father had actually been in atrial fibrillation for a month. And people didn't realize it because they were relying on the equipment and hadn't checked how well it functioned. so we're only as good as it is when the equipment is working properly. Remote patient monitoring is another area. And we have all sorts of devices. And again, Dr. Gustin will mention some of those. But one of them that I think of with some of the patients I have would be your patient with congestive heart failure. Their big problem is they retain fluids. And so they can have monitors at home where they can get their weight, they can measure their oxygen level, and you can tell if they are retaining fluid and at a chance of getting in trouble. You can have a fluid pill given to them in order to decrease the problem and prevent a lot of crisis just through the remote patient monitoring. Then some of your mobile health. I have a friend that has diabetes. She is able to attach a sensor to her abdomen that measures her blood sugar. Then this little device here gives her insulin. So she doesn't have to stick herself constantly like we have had to do in the past. Her readings about her glucose don't just go to her iPhone. They also go to her husband and her daughters, and they are alarmed if her blood sugar drops. And so even her daughter will hear the monitor go off, and she want and be able to call from her house and say, "Mom, your blood sugar's dropping." Her provider gets these readings as well and can say, "Okay, consistently at night your blood sugar's dropping. We need to change your medication." So again, another type of telehealth. Okay, so Dr. Gustin is going to take over now.
So I'm very excited to be showing you the next set of slides. I'm going to go through equipment first and then examples of how telehealth is currently being used. And I think some of it might surprise you when we say that it's telehealth. So when we look at these pictures to the left, that's kind of your traditional, what you're thinking of a visit. We're doing it right now. We have we have the computer, we have the camera on the top. That's a traditional telehealth encounter. The next picture with the phone is a device called TytoCare, and you could buy a TytoCare right now from Best Buy. It fits in the palm of your hand, and some of you might think of, well, golly, I had a lot of earaches when I was a child, or I had sore throats when I was a child, and with this TytoCare device, a family can have that at home and can actually send a picture of the ear to a primary care provider. They can look in the throat of their child and see whether it looks like strep. As you can see on the camera, there's a stethoscope that attaches the device that's round. There's a stethoscope that attaches to the back, and the camera will prompt the parent or the caregiver where to put that stethoscope. So that data can go across both real time or as a store and forward. So that's just one example that you could get right now. The next picture is the remote patient monitoring. The nurse is at home checking the pulse oximeter of the patient. The little screen that you see there is a dashboard that the patient puts data in regularly that then gets transported back to a provider and a nurse to manage that care remotely. The picture on the far end is actually a vision screener. So think about people that are not having that cannot get to an optometrist or an ophthalmologist, particularly children that have a reading deficit due to a vision deficit. So we can go into school systems now with this handheld device and actually scan a child's vision, print it out, and then determine whether they need to go to a ophthalmologist. Is it this one? An ophthalmologist for further evaluation and potential glasses. On the left-hand side is the cart that Dr. Rutledge talked about. That's your traditional cart that's rolled around in a hospital that you can take into a room with the patient or into a clinic and then remotely send the information back. The next picture looks like a coffee, like a Keurig, a coffee maker. What that is actually a medication dispenser. So a care provider or a caregiver can come into the home and will put medicine into this dispenser and lock it. And then a pharmacist or a physician or a nurse practitioner can then, through the cloud, regulate the medication and the dosing that that patient needs to have. Imagine this, you don't need to have those little 7-day squares that maybe somebody in your family has, or on Monday I take this medicine, you pop the top. So it alarms, and the individual can go in and get right dose, right time without anybody needing to be in the home to assist them. The next, you see a travel box. That is an indestructible box with telehealth equipment, with peripherals that can be dropped in from a drone into a disaster area. It can be carried into the field to care for someone. And then the far end is an example of a robot. I'm going to show you some pictures in a minute of what we're doing with this robot at our children's hospital. And they're being used for patient engagement. The robot can be operated remotely as far as states away to roll into areas to visit with patients. It's being used in school systems. And also in isolation, when you want to do isolation surveillance and not have people go into the room of somebody that has an infection. Just be thinking about this equipment and how it's probably been used during our public health emergency we're living through right now. Smartphone devices are incredible. I'm sure you all have a smartphone of some sort and are probably not aware of the additional things that can be done with these smartphones. To the left side is an EKG reader. If you've ever had palpitations or heart fluttering, a physician or a nurse practitioner might put you on a Holter monitor that you wear for a couple days, and they never see the heart palpitation. But with this device that you can buy on Amazon today, you can put your finger on this heart monitor when you feel that heart flutter. It goes to your phone and then can be sent both asynchronously and synchronously to your provider that is following this condition. You can also attach to your phone oximetries, that's checking the oxygen in your blood. You can also attach a ultrasound to do ultrasounds. You can attach blood pressure cuffs. You can attach glucometer readings to check blood glucose, all to your smartphones that you probably all have in your hand right now. And now I want to walk you through some technology that really is telehealth that is game-changing the way we care for people. This is an angel eye. So the angel eye is used in NICUs throughout the United States. It's a camera that's over the isolette where the babies are in the NICU. And we're using, angel eyes are used for communication and for bonding. Oftentimes parents have these babies that live for months in a NICU, neonatal intensive care unit, and they're not able to visit their children on a regular basis, or perhaps the family lives miles away from this NICU. So they can turn the camera on at any time and see their baby. They can watch the care being done to their baby. They can bond with the child with their other siblings. And they found that mothers that have babies in these NICUs that have angel eye have less postpartum depression, and they're able to nurse their babies for a longer period of time, which we know in healthcare is really the way to go with children, with infants. The next picture we have here is school-based telehealth. So some of you can think about your school nurse and how the school nurse is used in your schools. Many children are isolated K through 12 in areas that, one, either don't have a school nurse, or there's a school nurse and they don't have access to a primary care provider. So what telehealth does in the school system is the child can see the school nurse, who can then remotely visit with a provider away, outside of the school, to determine, does the child have strep? How's the asthma? Do they need a nebulizer? The diabetic is, what do we need to do with the diabetes? And the school nurse is incapable of doing that without having a nurse practitioner or a physician manage that. So this allows that child to get care in real time at the school system, and it keeps them at school longer. They don't have to leave that day and miss that entire day of school. If the child is really sick when you've done this type of care and they need to go home, with the telehealth, they can then bring the parent into the visit. The medication can be called into the pharmacy. So when the parent is coming to pick the child up, they can get the medicine, get the child, and go home. And think about it, never have to stop at a doctor's office for that sick child. So the next area in which we're doing quite a bit of telehealth now is military field medicine. So in 2016, military health added telehealth. They've added it for primary care, specialty care, behavioral health. They've moved out into the rural area. They've put telehealth on their mercy ships. But they're doing field medicine now with telehealth. So when a soldier is injured and the medics are there in the field caring for that individual, they can use telehealth, telemedicine to virtually visit with their commanding officers to help, for example, put a chest tube in, to put a tracheotomy in that maybe they need some direction and assistance. And that's how it's being used for field medicine. Home health has really expanded with telehealth. And so when I talk about home health, that's the home nurse going to the home to care for usually an older individual that is staying in the home, maybe post-op with a hip replacement or a knee replacement or congestive heart failure, something where they're not sick enough to be in the hospital, but they're so sick they need assistance from the home. Now, when the pandemic happened, nurses weren't going into these homes any longer. So the devices were then sent to the home and they were managed remotely. So you see this individual with his medication and he's talking to his nurse, going over his meds. You see his dashboard right next to the picture of the individual. And then what you have up top is what the nurse back in the office is able to see. When we say biometric data, that is cloud-based data going back from the patient's home to the nurse's dashboard on their weight and their blood pressure and their breathing, really whatever the patient needs. And one of the things I want you to think of is this is wide open. It's like 3 years ago when this started, we had the oximetry and the blood pressure and the stethoscope, and now EKGs are being monitored at home and ultrasounds are being monitored at home. And it's really a space where if you think it and you dream it can be developed and added. The dashboard IT, the connection between the two is incredibly important with regards to the design. Mobile stroke van. So strokes, a little bit about a stroke. If you have one kind of stroke, they call it a needle to door survival rate, meaning that from the time that the person, from door to needle, so that from the time that the person had the stroke, gets to the hospital, you find out what kind of stroke they've had, and then you put the medicine through the needle into the arm to bust the clot that caused the stroke, it means that they live. So you want that time to be as narrow as possible. So what they've done and piloted in New York, and this was a group of innovative nurses actually, had grant funding for a mobile stroke van. So anybody living in New York City, or been in New York City, you might be 5 miles from the nearest hospital and it takes you an hour to get there. So these vans are placed in high stroke areas, and they're staffed with nurses and telehealth and a CT scan. So when the individual is picked up from their residence, they are scanned immediately in this mobile treatment van, and the nurse then communicates back to the hospital to determine with the neurologist what kind of stroke it is, and they can start treating that patient before they ever get to the emergency room. Disaster relief is a real, it's a fascinating place that telehealth has expanded. And if you live in a hurricane area, if you live in an earthquake area, you're cut off from providers. So what's happening now is these boxes that you saw in a previous picture can be dropped in by a drone, and the emergency workers who are sometimes unlicensed can then use that box to start treating individuals in these disaster areas back to providers that are maybe states away. The boxes can drop in not only the telehealth equipment, but medication and other things that are critical to the management of the people in these disaster areas. Nursing homes are another area. Let me get to the next slide. Another area where telehealth has really been a game changer. So I would imagine some of you have family members that are living in nursing homes. And when an individual is in a nursing home, they are transported to the emergency rooms a lot, and they're transported for reasons that they may not need to go to the emergency room for. And it's very, very distressful for an elderly individual to have that type of transfer from a place that they are very comfortable and secure in to an emergency room for oftentimes it's a urinary tract infection. So what telehealth has allowed in these nursing home facilities is it's eliminated that need for that transfer to the emergency room, which is one, stressful, and two, costly. So we will set up the cart in a nursing home, and a provider with that cart that you saw in previous pictures and peripherals, the nurses there, when they're concerned, can have a visit with a primary care provider wherever they're located to determine what's the best course of action for this individual so that we don't have to have those unnecessary transfers. Telehealth is also being used in nursing homes during the COVID pandemic and our emergency that we're in now, where that equipment is actually connecting the residents to their families during this time of isolation. So I showed you the robot a little while ago. One of the projects we're doing right now at Old Dominion with the Virginia Modeling Analysis and Simulation Center, VMASC, which is part of ODU, is we have piloted the robot at the Children's Hospital and kind of flipped it on its head from what its original usage was, and realized that children were isolated and not able to visit with other children on the cancer unit. They were literally stuck in their rooms for months at a time because of their immunologic status. So we piloted this project. We had great results, but we realized didn't really work great. It didn't do everything we wanted to do. So our VMASC engineers and our nurses and parents have developed a focus group, and we're building our own robot. So that's an example of things that are in healthcare right now may not be the greatest, because the engineers that built it built a great product, but they didn't talk to the people that used it on the back end. So we think that we're designing a pretty exciting product now that we're going to take back to the hospital and pilot. And one of the things we did with this project is we brought in children, high schoolers actually, in a gifted art program, told them what we were building, and they actually designed what this robot would look like. So that's a pretty exciting thing, and it's telehealth. Apps are huge. Oh, I think I missed one. Okay, so the pain and palliative care project we're doing at King's Daughters and the Children's Hospital that I work at is the remote patient monitoring that Dr. Rutledge talked about earlier. And these are some pictures of the remote patient monitoring. But what we realized is these patients were really very isolated. They needed this type of equipment, and the equipment was really only built for adults. Again, product engineers designing something that really doesn't fit all needs. So we've been working with the engineers piloting the project to see what works for kids and what doesn't work for kids, and how they need to adapt their equipment specifically for a pediatric population. So we're 9 months into that project now and have some really, really robust, interesting data that's coming from the provider and the families that's going to go back to the engineers to redesign equipment that is specific to children. The trauma services, another thing that we're doing at the Children's Hospital that directly affects that we're working with engineering. One day I was kind of walking through the hospital, and they were talking about the trauma service and the trauma book. And when I say trauma book, it's a book. It's a hardbound book. And everybody was utilizing the book for the trauma services. And I was like, hold up, that's kind of crazy. Why don't we have this on an app? So again, engineering, the things that you can do as an engineer and the things that a person in healthcare know they need don't always intersect. So we're now working with the engineering, the computer science department at Old Dominion to actually build this book into an app that's interactive and can be used by everybody at the hospital when a child comes into the hospital in the trauma service. So car accidents and things of that nature, quick access. Another thing that's happened that's really exploded due to our the pandemic and the emergency state that we're in now is hospital at home. I know you're watching the news and you're seeing hospitals popped up um, in convention centers and whatnot. That's essentially, you know, a hospital outside of a hospital. So what we're doing now is moving the hospital to the home as much as possible, and that's with high tech equipment. Those are with ventilators and IV equipment, and it's beyond home health because the houses that what we're moving to the home is bed monitors so that you can get for a weight that the scale is on the bed so you can get real weights of the patient without ever having to go visit them. We're breaking down the walls of the hospital with this type of technology, and people are able to be in their homes, which then leads me to our hospitals without walls. There is a hospital in Minnesota now that have absolutely no patients. They are managing patients in small rural hospitals from their own from their hospital that has no walls. They have no patients. The centers that you see that popped up during COVID are our hospitals without walls. And that's a movement that you're going to see in your lifetime, in your very short lifetime, probably while you're in college. Much of what happens in a hospital is going to happen outside of a hospital. And really, when somebody does go to a hospital in the near future, it's going to be for surgery or for critical care. All of our care, because of technology, will happen outside. Artificial intelligence, for those of you interested in AI, this is where it's at right now in telehealth. And we're realizing that with all of this Bluetooth technology and all of the data that's going in, that AI is going to start coding all of this data for us. And we're going to be able to look at that data, and because of artificial intelligence, have diagnoses immediately at our hands because it's been coded through AI. We're also using AI to evaluate how a provider does a visit with a patient. You know, so we're using this type of information to then code their eye contact and their pacing and their empathy, and it's AI that's doing that for us. Holograms. Holograms are real, holograms are happening, and holograms are in healthcare now. The picture to the left, or the picture to the far right, is a physician in Australia who is taking himself holographically into patients' homes. And he's using his holographic image in the home, and he's pulling holographic images of the disease process to help to educate his patients. We're doing a lot of holographic teaching in the health sciences now, and particularly in medical school. So instead of cadavers, they're using holograms to teach our medical students the anatomy, the bones, the muscles, and whatnot. So that's a new place we're moving towards. Smartphones, we've talked about smartphones earlier. So these are just pictures again. The ultrasounds to the left, the center, you can look into somebody's eye clear enough as though you were at your optometrist or ophthalmologist looking at the vessels behind the eye. And to the right, again, you see the EKG monitor that you could look up on Amazon today. Issues, there are issues with telehealth technology. There's issues with everything. Scientific rigor. Privacy, those of you, it's HIPAA, it's keeping the privacy with the equipment that we're working with, and the cloud-based technology. That's where our IT specialists come in, making sure that what we've built is accurate, that we're having proper use. Broadband, everybody's not connected by broadband. Everybody doesn't have Wi-Fi. When we talk about smartphone technology, you need a smartphone. You can't use a track phone. You can't use, this doesn't work on a phone that you can go get and buy minutes on. So these are all things that we need to really think about and change as we move forward in the future, and as we develop these devices, that we put cellular capability in these devices. I mean, I'm not a tech person. I'm the healthcare provider that likes tech, and it's the tech people that need to work with us to say, hey, it doesn't work, and this is the way we need to do it. And with that, I really want the takeaway for you to be that healthcare and engineering are collaborators. We need to be collaborators. Engineers build the things. I say engineers can build toys all day. They know the technology. They like to build things, but oftentimes they don't talk to the end user. The healthcare providers, we take care of people and we know problems. I can walk through a building and say that doesn't work very well. And it's not until the engineer and the healthcare provider comes together, that we solve these problems. And I love problems because problems bring solutions, and telehealth is the solution. And I'm going to end with a story real quickly. I don't know how much time we have, but when Alexander Graham Bell developed the telephone, he actually was developing telehealth. And the engineer who developed it was a physician actually who developed the first stethoscope. Everybody thought he was crazy because prior to the time of the stethoscope being developed, everybody put their ear right on their patient's chest. So when the stethoscope came out, it was like, oh my gosh, you're crazy. Well, telehealth was thought of sort of like that. I don't think it's really going to work. It's kind of crazy. And then this pandemic happened, and we realize now that we're never going back. Telehealth is the solution to a problem. And we would love to take questions now.
Well, thank you, Dr. Carolyn Rutledge and Dr. Tina Gustin. We are going to begin our Q&A session, and it certainly was a very enlightening insight on telehealth innovations from both of you. And now that we're going to go to our live audience for questions, we want to remind our audience that you may continue to submit your questions in the Q&A box on your Zoom screen, and we will answer as many as time allows. And if you're anything like me, my mind was pretty blown away by all of the information that you presented. As someone who just recently started getting one of the smartwatches that monitors everything, I can start seeing how that information could be potentially connected to doctors and how they use that information. So can you give us examples of how some of the data that we currently have, say, on one of those smartwatches, what we can do proactively to share that information with our healthcare providers?
Yeah. Well, I'll give you an example that started happening several years ago with one of the first generation watches. People would show up in the emergency room with what looked like a heart attack, and the physicians and the ER could take the watch off and open it up, get somebody to get into the watch to determine from the rhythms what had happened, what type of event had happened with that individual, to then know how to start treating it. Right now, there is research being done with the Apple Watch for oximetry reading and heart rates, but I watch mine and I know that my heart rate is low in the morning. I know what my peak is exercising. So certainly that's a conversation to have with your provider if you're looking at heart health, weight management. You can log it and say, this is what my standard heart rate is. This is how many steps I walk in a day. And it's not, well, I think I do this. You can really say, no, these are my steps. This is my heart rate.
Yeah, and other places that you see it, and this has happened over and over, is people taking pictures of things. Like, it's even used in veterinary medicine. And in fact, I had a horse that was injured. I took a video of the horse when it was doing its problematic thing, took it, and when I met with the vet, I said, well, this is what it looks like. I have had patients come in that have had an allergic reaction, and they aren't having the symptoms then, but they can show me on either their smartwatch or their iPhone what it looked like when they did react.
One of the other things we're finding with the smartwatch users is as you can imagine, the psychology behind it, that it really does make you accountable for your own healthcare.
It really does. And going back to one of the words that you use, you called it a hospital without walls. And so it was really interesting that now, whether it's the smart devices or all the creative ways that providers are finding on delivering care to others, how this is really changing the landscape of how, perhaps we don't need to go in person as much as we used to. And certainly with the current pandemic, right? Many of us have dipped our feet for the first time in telehealth consultations, right? Whether it's a dermatology appointment, whether it's a mental health check. It's just really interesting to see how more providers are now supporting those efforts. And so when we talk about these hospital without walls and making sure that we're bringing care to underserved communities, one question that we had from the audience is, what happens when some of those rural communities, let's say, lack internet, or they may not have computer equipment? So what are some creative ways that people can still take advantage of telehealth in those rural communities?
So, some of the things that we recommend, one is, really start lobbying to make that happen. There's a satellite, using satellite dishes and so forth. Also going to places that have it. For instance, you can go to the library. Even here in Virginia Beach, many of our homeless don't have tech. They might have a need for it or a track phone, but they go to the library to utilize that to get some of their services. And so, really connecting the community with places that do have technology that works.
One of the things I would also encourage as people are thinking about developing equipment is having the cellular capability built into the device, which is still spotty. In our project with the children, we have some families that are in some pretty isolated areas. So the devices they have the cellular capability built in, and with that, it's still a little jerky, but it's better.
That's helpful. And it was also intriguing to see how, when you described a patient, let's say with Alzheimer's, right, that rather than taking the patient out of their home and their comfort, that you're able to bring the patient to the home was really interesting. And then when you talked about pairing that with having family members, let's say that you have a brother or sister that want to be involved and engaged in the care of a parent, but they're not physically there. And so usually the care falls to one sibling, right? So now you have an opportunity to potentially bring all these other family members into the conversation, so they're all on the same page and they can all take an active role in caring for that parent. So I thought that was fascinating as well.
It even goes further than that with what we call the smart homes, where they have homes set up so that they can monitor the patient, and you can keep patients in their own home rather than going to a nursing home or a skilled facility. For instance, there was one incident in Virginia that was pretty fascinating. The husband and wife lived together, but they had the smart home rigged for the son who lived 3 hours away. And he was able to tell that his mother had fallen and what room in the house she was in. The husband was sitting in the living room watching TV, had no idea that it happened. He was able to call his dad, tell his dad, Mom has fallen in the bedroom. They got the rescue there to help her. She had had a stroke, and you're able to address these issues. So there's a lot of stuff being done with these smartphones, and it can monitor through any of the rooms. It's really pretty fascinating.
I was wondering too, as we were talking about the angel eye that's used in the NICU, couldn't you do that also for patients, let's say, that do have Alzheimer's, where you would be able to monitor the parent in that way and then also engage with them, so you have that connection and engagement and they don't feel as isolated? Yeah, it's just, honestly, like everything you presented is just mind-blowing.
The angel eye was developed by a neonatologist who saw a problem and saw a need and found an engineer, and together developed that, and it's just kind of pushed throughout the United States. I think truly the best devices come from somebody who has the problem. who then has the relationship with an engineer to then become this business.
One of the contracts that Dr. Gust and I were put on, it was a MITRE contract. What their job is dealing with security, and they were realizing that remote home monitoring, that there could be some problems with loss of security, invasion of privacy. And so they brought the two of us on as their clinical consultants. We could talk about the experiences the patient had, places that issues could occur, and they could build the technology. And we just recently saw, and they're hired by the government, recently saw where they have developed the whole protocol. It's gone out for public comment and soon to be released. And so that is sort of the formula for anybody who is developing remote home monitoring equipment. And so we're being pulled into some of these other areas, but again, we can represent the healthcare, the patient, the provider, but we can't sit down and say, you need to hook this wire here and do this to make it happen.
That's incredible. And some members of our audience were really intrigued about the robot that the students helped put together. And they were wondering when something like that might be available in the market.
That is a great question, and I would love to tell you it would have been this past year. That was our goal, and then when we all went into shutdown, we had hoped that by this time we would be doing some early market analysis with it. It's probably a year out with our work, with where we're going with it. And if you look up a robot now, you can find one, but this I'm really proud of. It's very different. It's built specifically for a hospital. We've taken into consideration of the elevators and the ramps and the lifts. We brought in the kids to draw out the design of it. We brought in the families to tell us what do you think it should have. We brought in the patients. So cross our fingers and say a year, people.
And so we just have time for two more questions. And one of the questions is, they want to know if you can tell us more about how you foresee the field evolving in the next few years. And so I know that you started to talk towards the end of the presentation about things that many of us could never imagine other than in a Star Wars movie, right?
Maybe that's where you need to start. Just watch Star Wars and you'll come up with new ideas. We'll be transporting people.
There will be robots, there will be holograms. AI is huge. I don't think we can, if you can dream it, it will happen. I mean, the TytoCare, the idea that you could hold that device in your hand and have that at home for someone.
It's incredible.
It's incredible. I think our smartwatches are going to be smarter. I believe that our smartwatches are going to be able to detect glucose for the diabetics. I don't know. Yeah. You tell me.
And I think it's also interesting looking at other fields and going, how is this going to work in healthcare? And you can get ideas and bring them back. If you think about telehealth, it goes all the way back. The astronauts, when they first started going to the moon, telehealth was being used there. If you remember them talking about monitoring their heart rate and all of this, and how far away were they when we were monitoring them? So just,
Our president of the United States since the first Bush administration has had telehealth in the White House.
Wow.
Little did we all know that.
Well, and I hope that this is just the start to inspire many of the people that are attending in the audience. And with that, we just have one last question. What are some tips that you have for those that are looking to pursue a field in health sciences? I know that I heard you say that things like the robot took art to creativity and took also people who were in the sciences or in engineering. So what tips do you have to aspiring students who would like to study health sciences?
Well, you just have to think about what you're interested in, what you find fascinating, because field after field can bridge into it. I mean, if you're an artist, there's art therapy that you can do with patients. It's a way of dealing with mental health issues through drawing and so forth. I mean, if you any of those areas can fit into healthcare, because that is just really focusing on individuals. Technology, any field of technology, our electronic health records are tied around technology.
I always say nursing has been so good to me, and I've never been bored, and the opportunities that I've had. If you had told me when I was 18 going to nursing school that I was going to be building a robot with an engineer for the patients that I love, I would have never believed you. That's my comment.
And next they might be building holograms, right?
Right, right.
And when I look at it, the reason I chose nursing was because it was the one field that had more doors open. And I am not one that does well with just staying in one place forever. It's allowed me to be a little bit of everything.
That's really wonderful advice.
Yeah, so that's a shout out for nursing.
Absolutely. Well, thank you so much. And that's all the time we have for the questions today. But on behalf of President Broderick, Provost Dostinago, and Old Dominion University, and the REYES program planning team, please join me in the audience in thanking again Dr. Carolyn Rutledge and Dr. Tina Gustin with a large virtual applause. I'd like to also extend my gratitude to the Office of Strategic Communication and Marketing and the Office of Community Engagement for their support of the event. And to our audience, thank you for tuning in. For more information about upcoming REYES lectures, visit odu.edu/REYES. And this spring actually, we will be exploring offshore wind energy, cybersecurity, and simulating laws of nature, and many, many more subjects. So we look forward to joining us soon. And today's session has been recorded. So if you'd like to watch it again or share it with friends, you can access it from the REYES website at odu.edu/REYES, which is REYES. So this concludes today's program. Please have a wonderful rest of your day.
Thank you.